My name is Derek Coy, and I'm the Veterans Health Officer here at New York State Health Foundation. When I got out of the service in 2008, I actually had a pretty tough time transitioning, like too many of my fellow veterans.
New York State has the fourth largest veteran population in the whole United States. Vets are strong. Most can reintegrate into civilian life without a lot of problems. But some of them do experience physical disabilities. They struggle with mental health issues or substance use issues. The first thing you want to do is listen to vets themselves, what they need, what they don't want, or what they do want. We started off our work by commissioning the RAND Corporation to do what became a landmark needs assessment. The key finding that came out of that report was that about half of veterans would prefer to receive their care in their own community.
When you're in the military, one of the best things about it is that sense of community. You make sure that you take care of the person on your left, the person on the right, and when you get out, it's the exact opposite. It's very isolating. What we want to do for veterans returning to New York State is really create that similar community that they've already thrived in.
Veterans should have choices. If they want to go to the VA, then they should have good access, quick access to high quality care. And if they want to get care in their community, then that should be available too. The Foundation is uniquely qualified to bring together different parts of the veterans community, veterans themselves, organizations who serve them, policymakers at the city, state, federal level, and try to move the needle on these issues.
What we want to do is make sure that the best-in-class service providers that are really making an impact on improving veterans' health are identified and they're connected with veterans. We've had amazing partnerships with the Buffalo Veterans Treatment Court, the Mental Health Association here in New York City.
We serve as an important convening body to foster greater public-private partnerships between the VA, community providers, and private funders to better coordinate service delivery and ultimately to provide better access to care.
What we're looking to do in the future, though, is invest in new emerging innovators, people like the Patton Veterans Project.
We invite veterans, and in some cases their caregivers or spouses, to make movies over the course of several days with the idea that there are certain things that veterans, in particular combat veterans, may never be able to speak about in a conventional way, but we feel that maybe they can make a movie about it. You know, that making a movie allows you an opportunity to change your narrative.
If there's one thing that we learned in the military, it's one team, one fight. We're all on the same page. We might not agree, we might come from different places, but we're all going to come together to attack this one common goal. It really is an all hands on deck effort, and we want to partner with whomever is really going to help improve the health of New York's most vulnerable populations, especially our veterans.